I was at home one night and I don't even know why. I just was lying down and I kind of just started to feel. It's not something that I did normally. And I just did a scan of my breast and I felt something. And I remember asking my mom, I was like, Mom, do you feel this? Is there something there? And she's like, I'm not going to feel your breast. And I was like, no, I think there's something there. And then I kept telling myself, oh no, it's probably nothing. But I just, again, I knew that it was something that I hadn't felt before, and that's what prompted me to come in. So I went online and I found the Susan G. Komen site for Fort Worth, and then I went to grant recipients and I looked for organizations that were listed under grant recipients, and then I called Kupferle directly and I said I need to schedule a mammogram, and so that's how we started. Pretty much as soon as the doctor read it, there was calcifications, and from what I understand now, it was because of the pattern of the calcifications, and that they were quite small, and she wasn't even sure how I felt it, but that she was glad that I was there, and they needed to schedule a biopsy straight away. So 2 days later, I was back for a biopsy, and then a few days later, it came back saying that it was breast cancer. Well, first I remember laughing but it wasn't an outside laugh, it was more in my head. And I thought, oh my God, I am so in Texas, because the lady, I don't know if it was a nurse or whoever it was, but she called me and she said, we got your pathology report back and it is the cancer. And I just remember hearing, the cancer. And I was like, oh, and then I was like, holy cow, wait a minute, she's talking about like cancer in my body. So it was pretty overwhelming. It was complete, like, paralyzing fear. And I remember trying to talk to my dad and tell my dad, and I couldn't even say the word.
Can you imagine a woman laying in bed one morning and feeling a lump somewhere, her neck, her breast, her abdomen, and going, what is that? Who will I call? How can I trust that person? That person doesn't speak my native language. How will I afford it? Can you imagine living with knowing something's wrong with you or suspecting something's wrong with you and not knowing where to turn and what resources to get? A lot of these women are very anxious. Even the well ones come in very anxious.
Our patients come from all walks of life. They can be culturally isolated. They're uninsured. They may have more than one job, and so coming to get a screening on our mobile unit is very convenient for them. We also may see women who have just been recently unemployed and don't know where to turn.
I have always been the person to take charge, make my appointments. I made sure I was there for my appointments because I take my health very seriously. But, the last couple of years, my funds have been low. I haven't had enough money for my mammogram, and so I took charge. Now there's a solution. Now I have a place I can go that I'm pleased, that's there for me. The only thing I have to do is pick up the phone and make my appointment.
The services that we provide on the mobile health units are related to early detection of cancer and risk reduction for cancer and heart disease.
The goal behind the first mobile unit was to provide access for women to receive mammograms. And then as the program grew, we saw that women needed more than just mammography. And so I believe it was in the late 90s, maybe 2000, that we thought, providing pap smears on the mobile unit, because if you're getting a mammogram, you're also needing other services.
We do all kinds of screening on the mobile. What we do a lot of is screening mammograms. Women who basically just want their breasts checked, not because they necessarily have an imminent problem, but because they just want to know everything's okay, because that's the beauty of screening mammograms, is we find something early before there really is a problem. They also have complete head-to-toe physical examinations. They're getting their weight, their blood pressure, they're getting their blood drawn, they're getting examined head to toe, including breast, pelvic exam, pap smear, rectal examination, Whatever a woman needs, she gets a comprehensive physical examination. She may be getting a colon kit. And we also do screening for osteoporosis, which is bone loss. You know, the whole focus of the mobile program is early detection and prevention. That's what we do. We don't treat the blood pressure, but we find it out before it goes into heart disease. We don't treat the diabetes, but we find out as the blood sugar is rising before they start getting into complications with their eyes or their kidneys or their circulation. It's so much easier on so many healthcare problems to treat it early rather than late, because then a cure is possible.
Breast cancer or cancer of any form does not discriminate. And you can't do anything to guarantee you're not going to get it. The only thing you can do is be vigilant and try to watch your health and try to maintain any kind of screenings or whatever so that, you know, you can hopefully catch it early.
The funds that are raised through Puttin on the Pink are vital to the success of this program and also to getting these services to women who wouldn't otherwise get them. We're connecting women not just to screening mammograms, which is a life-saving test, but also improving the health of their entire families.
The future of the program is purchasing another unit. We see on a daily basis the need is growing, and it's not just here in our hometown, it's in the surrounding counties. And what's amazing is technology continues to grow. And the units that are available today have satellite dishes where a lady out in Hood County could be getting a mammogram in the parking lot of a grocery store. Her images can be beamed back to the breast center. A radiologist can read them and let her know in real time whether she has a problem or not. And if she does, then we can get her into the system much quicker and be able to give her life-saving services.
I've been so thankful to God for this mobile unit. I've just been so thankful because any other time I would not have been able to afford to go to a hospital or to a doctor's office and get, you know, my mammogram and my wellness, you know, performed.
I just feel so blessed that I was here at the Metroplex and that Kupferle was here. And that there are organizations like this out there that provide this service for women, you know, who don't have insurance and need to have the care.
A few weeks ago, I was having a bad day on the mobile. Our mobiles some of them are almost 10 years old or over, so sometimes in the morning they don't start, or the air conditioning is broken, or any number of things. My first patient comes in, and I knew that I had to kind of get my decorum and take care of her in a professional and appropriate and kind way, but I was frazzled. She stopped and she grabbed my face and she said, "Muy amable." In Spanish, "muy amable" means "you are so kind." And I started to cry immediately because, you know, I had come in a little stressed. And for someone to say, "I am so kind," but the thing about that I thought immediately was, I am not so kind. It's the women and the men who give me this money to come on this mobile, to give you this service, to make you feel well. I am not so kind. It is you that is so kind to give me the resources to take care of this woman. Muy amable. You are so kind. Muy amable.